With COVID concerns still going on more than a year and a half later, it can be difficult to get in to see your doctor for other issues at times. So now we're hearing more about the term concierge medicine.
But what is it? Morning anchor and health reporter Kirsten O'Connor is on assignment. Sabrina Bowles is standing by now to Ask a Doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
When it comes to concierge medicine, one of the things patients like is the ability for more personalized attention. So Kirsten O'Connor had a call with Dr. Jason Littleton of Littleton Concierge Medicine to explain how it all works.
Concierge medicine is private medicine. It's membership-based medicine. Unlike insurance-based medicine that most of the population's used to, concierge medicine is where a person pays an annual fee and they have direct access with their doctor. Now listen, not to confuse anyone, there's really two terms in play. There's something called DPC, which is direct primary care. And that's really more what I practice, where you have access with the patient has access with you and they pay a membership fee. Concierge medicine actually is a mix of that, plus also taking insurance.
Dr. Littleton says it's about someone who really is on your side when it comes to your health and knows what you have going on at any given time. And when you call him, you're actually reaching him and are able to get feedback on any issue. It's much more about a personal connection with your doctor.
In that setting, you're seeing a doctor seeing about 25 to 30 patients a day. You know, I kind of joke around and call it conveyor belt medicine because each patient gets about 15 minutes for a follow-up, 30 minutes for a new patient visit. Whereas in concierge medicine, I spend about 45 minutes to an hour with my patients. And here's the thought. In insurance-based medicine, where that doctor's seeing about 30 patients a day, in the middle of that, they're also probably doing 17 callbacks, reviewing 11 x-rays, making 12 prescriptions, all while they have patients back to back. And one of the things that makes concierge medicine really appealing is that patients do not have wait times. You know, they have an appointment and they're seen at that time. There's no one in front of them and there's no one behind them. So they can really have that time that's devoted to them. And in my practice, I have this 4-patient rule actually, where I only schedule 4 patients a day. And I really want to make sure that I give my patients the attention that they have. Of course, we deal with emergencies and we deal with urgencies. But when it comes to that bread and butter physical exam, where I'm spending an hour with someone, I want to make sure that they have devoted time.
Of course, all that personal attention does come at a price. Dr. Littleton said typical annual price ranges for concierge practices can range from $2,500 to $10,000 annually. But during the summer, while many Central Florida hospitals have seen an influx of COVID patients, Dr. Littleton says he's getting call after call from patients right now with both coronavirus concerns and everyday health issues.
I have patients wall to wall right now. Really, I'm getting calls every day about people who may have coronavirus concerns or even other concerns. And here's the thing, when there are coronavirus concerns, you have to address this immediately. Sometimes what happens is that because people are so concerned about the virus, unfortunately, some of their chronic conditions, they're not addressing right away. And so you always have to ask people, how are you doing with your diabetes? Are you having other issues that you may have concerns with? You know, we have to definitely address the coronavirus, but we can't neglect some of the other things like coronary artery disease, diabetes. And, you know, I just remember early on last year in the pandemic, where a lot of people at that point in time did not want to go to the hospital because of the concern and the fear of going to the hospital. There are a lot of things that were neglected.
Dr. Littleton, as well as other doctors we have spoken to during this whole pandemic, do urge you to take care of other medical concerns you have and not to wait. The problem is the longer we put things off, not only can they become worse, but doctors and hospitals will still be inundated with a rush later. In most cases, you do not have to be worried if you're not vaccinated. You'll still be treated at an emergency room.